Malnourished children, weak women and lactating mothers in dire need of medical services to get back to health after a long trek from Somalia to Kenya fleeing a harsh drought in Somali are fighting for their lives at Daadab Dagahale camp. The crisis is getting worse as Medicines Sans Frontiers staff have gone on strike. The staff went on a go-slow, putting to halt any operations in the camp's hospital. According to sources on the ground, the medical staff staged a go-slow since Sunday evening. MSF workers who spoke to KTN say their salary has not been reviewed for the last 2 years despite frequent promises for an increment. Sick refugees remained unattended, putting lives of hundreds of weak, sick and malnourished refugees at a greater risk of death. Reports indicate that those flocking into Daadab from Somali will now have to camp outside the camps for longer periods. A screening process that include health checkups is also being affected by the strike. Already hundreds of refugees are camping outside the camp, awaiting registration and admission into the camps. MSF offers medical services to Dagahale camp, which hosts the majority of refugees in Daadab. MSF boss is already in Daadab, and the organization says it is going to work things out as fast as possible to avoid any possible crisis. The strike comes at a time when thousands are fleeing Somalia and arriving in Kenya already too weak and majority sick. 1,400 Somalis are streaming into Kenya on a daily basis, and this has caused a strain on the camp's resources that were meant to cater for only 90,000 refugees, but now catering for 4 times the number. MSF is one of the groups working inside the camps to offer medical services to the refugees, and now with many at risk of death, the health need is critical. There are only 3 organizations allowed to offer medical services inside the Daadab camps. Angel Katusia, KTN Prime.